health to make sure that we have a safe environment for our members and our staff and our children and families to come to. These protocols are significant, and what's best is that what we know is you will see it. When you walk to the door, there will be somebody there to take your temperature. Our people will have PPE equipment. All our cardio equipment is spaced at least 12 feet apart. Some of our equipment will have signs that says it's not operational. We will thoroughly be cleaning our facilities and enforcing rules that members wipe down equipment before use. Everyone who enters our facility must wear a mask, and all of our staff will be wearing masks throughout the day. Many of our facilities will have arrows on the floor indicating where you should come in and where you should come out. Because of the guidelines, and we want to make sure that, one, we have a lower capacity, so our facilities will be operating at a 50% capacity, and we will continue to offer virtual classes that many of our Ys have began over the course of this COVID pandemic. You know, these are just a few of the safety features that we've put in place to make sure that our staff, our family, our members, the people that we serve will feel comfortable about coming into the YMCA. And for us, the YMCA Greater Hartford was fortunate enough to work with Trinity Health of New England to help us create reopening guidelines. We've actually had their chief epidemiologist review all of our protocols to make sure that we had a safe facility. Many of our other YMCAs have partnerships with health systems within their cities and towns to ensure that our Ys are safe and healthy. You know, the COVID pandemic has been challenging for all of us. We'd also like to thank our volunteers and staff for all of their efforts. We couldn't have done any of this without them. On behalf of the Connecticut Alliance of Ys, we'd like to thank all of our members for the patience you've had on reopening, and we appreciate you sticking with us, and we will keep communicating as new information becomes finalized. I want to say thank you for everybody coming here today, and I'd like to take this time to introduce Mark Pooler, the CEO of the Southington Cheshire Community YMCA, who will address the opening of our summer camps. Mark?
Thank you, Harold. Thank you, press, for coming out today. As Harold mentioned, my name is Mark Pooler. I'm the CEO of the Southington Cheshire Community YMCAs located in Southington, Connecticut. And I'm also the proud father of Matthew and Abby Pooler, an 11-year-old son and a 9-year-old daughter, who I dropped off at summer camp today at YMCA Camp Sloper. And I can't tell you how excited those kids were and all the kids that we saw at the camp this morning. And I think that's the feeling of a lot of children across our state. So while YMCA Camp Sloper opens this morning, we're hoping to have roughly 500-plus campers a week out at the camp. We have 2 other camps in our communities in Cheshire, also another small one in Southington. As an association, we're hoping to serve over 3,400 children this summer in both Southington and Cheshire. In Connecticut, we've got 47 YMCA summer camps that are in operation starting today. We expect an average about 19,000 campers on a weekly basis, and we hope to serve over 27,000 children who will have the opportunity to experience the benefits of summer camp starting today, June 22nd, all the way until the end of August. The YMCA believes that children are one of our most valuable resources, and it's our job to help them reach their greatest potential. That's part of what summer camp does. Summer camp gives children the opportunity to have a sense of normalcy, gives them an opportunity to socialize with children they haven't had the chance to do in the last few months. Gives them interactions, chance to be outside, a chance to be away from screens, a chance to be active, and a chance to have some good old-fashioned summer fun. Camps might look a little bit different. We've got some smaller group sizes this year. We've got increased cleaning protocols. We've adopted a lot of safety guidelines that we've developed with the environmental health and engineering company that's based out of Boston. They've been working hand in hand with YMCA of the USA and the American Camping Associations, just 2 of our partners who are helping to deliver summer camp on a safe and sensible basis this year. In addition, we're obviously following all of the CDC guidelines and following the advice and guidelines of the folks at the Department of Early Childhood. So summer camp, we're going to focus on a number of things this summer. We're going to focus on kids helping children getting a chance to help their social, emotional learning, their interactions that they've missed out on in the last 3 months. We should not undervalue that summer camp's going to provide a valuable outlet of childcare so that parents can get back to work. Going to give children the opportunity to learn new skills, develop friendships, try new activities, and of course, have fun. Most importantly, we're going to look out for the safety of each and every child who attends our summer camps. So we're very excited to do this, and as we have surveyed parents across the state of Connecticut, they are also excited that their children will have some of their childhood back this summer. Well, thank you very much. At this time, I'd like to welcome Denise Leonard, CEO of the Camp Hazen YMCA in Chester, Connecticut, to talk about the impact the YMCA has had during this pandemic. Thank you.
Good morning. As Mark said, my name is Denise Leonard. I'm the CEO of Camp Hazen YMCA in Chester, Connecticut. While many Y workout facilities and pools were closed during the past 3 months, most of the Ys in Connecticut, thank you, continue to operate in many capacities. The Y isn't a building. It is people from all backgrounds and walks of life who come together to improve their lives, nurture their families, and strengthen their community together. I'd like to share with all of you some of the very important services that Ys have provided during the COVID-19 pandemic. Since the end of March, Connecticut's YMCAs have provided a child care to the children of medical professionals and first responders. Almost 500 children a week have attended one of our 26 emergency child care centers. Our Connecticut Ys have distributed almost 2,500 meals weekly at 12 different distribution centers. Over 1,200 Connecticut residents have donated blood at one of the 20 blood drives we did in unison with the American Red Cross. The Connecticut Ys also distributed almost 1,500 diapers and 1,500 masks to residents of Connecticut. 27,800 Y members participated in virtual fitness classes. This included almost 13,000 seniors and 7,500 youth. Our Ys have partnered with many local community organizations during the pandemic to provide services to the residents of Connecticut. There are actually too many to list, but I wanted to share with everyone a few of the groups that our Ys have worked with. The American Red Cross, the United Way, local chambers of commerce, local food banks, Rotary clubs, community farms, school districts, and park and recreation departments. We've also worked with local healthcare systems, including Trinity Health, Yale University, Waterbury Hospital, St. Mary's Hospital, Gaylord Hospital, and Charlotte Hungerford Hospital, just to name a few. As you can tell by my remarks, the YMCAs of Connecticut were never closed. We continued with our mission of youth development, healthy living, and social responsibility. And now I'd like to invite Harold Sparrow back to close out the press conference.
Thank you, Denise. At this time, we'll be open for... Oh, excuse me. Can you hear me okay? I want to say thank you, Denise. As you can see, even though we were closed, we were still open and working hard to serve the communities within our geographic locations. So we want to open up now for any questions and answers that you might have from the press, Q&A.
Mark.
Oh, you can't hear me?
Mark, Keith McGilvery from Fox 61. Thank you for your time. I wonder if you would speak. Harold was on the Fox 61 Morning News earlier today talking about reservations that parents might have in sending their kids to one of your facilities. I wonder if you'd speak as a parent to kind of what you would say to that, what you would want a parent to know.
Sure, I'd be happy to. Thank you. So the question would, what some of the reservations might be for parents sending their kids to camp. So as I mentioned, we surveyed a lot of parents across the state as a YMCA. We put out a statewide survey, both Connecticut and Rhode Island, to get a lot of feedback from our families. That was valuable information to have. The information that I have looked at and what my conversations have been is I feel like parents are in thirds. There's 1/3 of this population that's ready to go. They want their kids to go to camp and they're eager to get them back. There's another third who's been quarantined for 8, 9, 10, 11, 12 weeks, and they're nervous, and they're uncertain about that. And we've given them the opportunity to either attend camp or give a full refund if that is the case that they needed to do. And then I think there's a group that's in the middle, and I think that's maybe where your question is coming from, is what are those parents thinking, the ones that are in the middle of those two particular thought processes? I think some of their concerns, and of course, is safety. Is it safe for my child to go to camp? And I'm here to say that I believe that our camps have done an outstanding job following all of the guidelines set forth by CDC, by the American Camping Association, by the YMCA of the USA, to make parents and kids feel safe while they're at camp. Some of the other concerns are, there's a lot more rules this year. Are my kids going to have fun? And I can tell you right now that one thing that hasn't changed is the role models that are providing these camp services, and I think they're there to deliver that same level of fun.
Can you talk about the challenge of feeding kids? I know that was a big thing, not just in the sleepaway, but also the day camps that make kids eat in dining halls. And how can you accommodate that and not have so many kids in one area?
So a lot of the camps have had to do that on an individual basis. Many of our resident camps have decided to pass on this summer because those challenges are real and didn't think that we'd be able to do that in a safe and sensible manner. A lot of the day camps are having children bring their lunches in, eating under pavilions or tents or shaded areas. The key is that each of these groups of kids that are coming are staying in cohorts or pods of 10, and they're not going outside of those groups of 10. So there is minimal, if any, intermingling between the different groups. So we're helping to keep them safe by keeping them in their small groups or families.
So from your interest this year to, say, last year, is there more interest, less interest, you still have openings?
I believe that many of the camps across the state will still have openings because, as I mentioned, some parents are just not ready to send their kids to camp. And I think that that has brought some enrollment challenges for some of our camps. I can speak to our association. YMCA Camp Sloper typically has about 700 kids a day, and we're looking to see about 500 throughout the course of the summer with most of our sessions. So there is still availability if parents are feeling good about it and want to put their kids out at camp for a wonderful summer experience. Kids need it. I can't think of something that kids need more than summer camp right now. They are wired to be around other kids, and that's not in a rectangular box or on an Xbox or any of these other screens. They need social time. They need social interaction. They need to get outside. They need to be active. They need to get a chance to be kids again, and that's what summer camp's going to deliver.
Mark, what did you say to your own kids this morning, 9 and 11, for a child who's old enough to take a little personal responsibility? What do they need to be thinking about at camp as they try to stay safe?
Great question. So we did have a little heart-to-heart this morning because my kids are concerned that they're not going to get a chance to do all those same fun activities that they typically did in years past. So we did have a little talk, and we said we got to be patient. This is the first day. There's a lot of new protocols in place. There's a lot of new policies in place. And quite frankly, everyone in the group might not feel as ready to go to camp as you are. So your job is to help ease their mind, to tell them it's going to be okay, to make them feel comfortable. Pleased to report that prior to this press conference, I just got a text from the camp director, and my son is 30 feet in the air on a ropes course right now. So I think he's doing just fine.
What about your gyms? Could you speak to those facilities? And I know a lot of people have had reservations about returning to a workout-type environment for some of your older members.
Absolutely. I think what's important to understand is that we are following the CDC, the Connecticut State Guidelines, and basically the recommendations from our departments of public health. So we are ensuring that there are spacing protocols within all of our equipment, that when people are walking through the facilities, they will wear a mask. As a matter of fact, the only time we're asking that you're allowed not to wear a mask is if you're on a treadmill or a cardio machine. Other than that, within the facility, you will be asked to wear a mask at all times. For some of our wives, we have towel services. We offer yoga, but we will not have towel service, and you will need to bring your own yoga mat if you wish to participate in a class. Most importantly is we will be doing hourly cleansing at all of our facilities, and at night we'll be doing extremely a deep clean in all of our facilities.
What are your plans if a case or two pops up, be it at one of your gyms or at one of your summer camps?
So we have, how should I say this? We have protocols and procedures in place. If someone pops up that is COVID positive at our YMCAs, we will shut it down. We will ask everybody to leave. We will then implement deep cleaning procedures, and then we will work with our Department of Public Health as to what are the next steps. All right?
And does that cover your summer camps as well?
Absolutely. It is challenging. That's a good question. But for YMCAs, we have a double bottom line. One is clearly we want to end up in the black, but two is we have a bottom line to serve our mission. So we want to make sure that we create policies, procedures, and interdependencies that will allow us to keep our facilities open. I mean, what is unique about our association is there are 21 YMCAs represented here. The CEOs had a meeting every week. But we broke it out into working groups. So our aquatics departments, our membership departments, our child care departments, our camp departments, within our YMCAs across our teams worked together. This is kind of different in Connecticut, which prides itself on being independent, which prides itself on working in silos. So I think for our alliance and our association, it has really been a mindset shift. It's been a paradigm shift as to how we think, operate, and act in the future. And I also believe it will help us moving forward as well. If there aren't any other questions, I would ask you to take a look at your press kit. And, you know, we have YMCAs here from all over the state. If someone is close to you at your YMCA within the area which you work, please find out who he or she is. And I just want to once again say thank you to everybody who's coming, and we look forward to having a safe summer. Yep.